A little bit of time today before the case, talking about the history of the COVID vaccine and certainly those dispelling some of the myths that go around it. Next slide, please. So these are our learning objectives today. Describe differences in the types of vaccines. So COVID vaccines, explain the common myth. They look at Bloom's taxonomy of COVID and apply the strategies for communicating uncertainty to the community. Next slide. So just looking at COVID vaccine, this is probably a review for many of you. The infectious disease was caused by the recently discovered virus SARS-CoV-2 in Wuhan, China. It is COVID-19 because it was December 2019 that it was discovered or first noted. It's actually oldest common ancestor of the coronavirus dates back to the 9th century BC. So these viruses are not new necessarily. This variation may be new, but the ancestors are not. If you think back to the great flu pandemic of 2018, which was 100 years ago, which was very deadly, exceptionally deadly worldwide, it was caused by H1N1 influenza A virus. In the flu pandemic, of the great flu pandemic, there were 4 successive waves, just like our pandemic has been going in waves. At each wave during that time, there was many people infected. In fact, a third of the global population, which is about 500 million. And the death range was from 17 million to 50 million. Now, this marked the second deadliest pandemic after the Black Death, which was the bubonic plague, and that was in the 14th century. Next slide, please. And symptoms, just to briefly be sure that everybody's on the same wavelength about the symptoms of COVID. The most common, you've got the high fever, body temperature going above 99 degrees, tiredness, fatigue. This is what I hear in the community. Many people who have it do complain about is the fatigue. And then a dry cough, not where you see or hear from allergic rhinitis or bronchitis, more of a dry cough that comes from COVID. So these are symptoms that we can communicate to community members as most frequently cited. However, there could be other symptoms as well. But certainly this does trigger for that person in the community to consider testing that if they are positive for COVID. Next slide, please. Now, the whole issue about transmission of COVID and what are the mitigation strategies we put into the community. It's important to be able, that we want to explain why these mitigation strategies are important, because we know the spread of COVID is from person to person through those small droplets, air droplets, from the nose or the mouth when an infected person coughs, sneezes, or exhales. Okay, so you think about mask wearing, okay, because we know it spreads that way. And we also know droplets that land on surfaces may mean that a person can pick it up from that surface. They put their fingers to their eyes, to their nose, to their mouth, and it's transmitted to them. So again, reason for the social distancing and also the hand washing. If you have touched a substance with it on, you wash your hands. So these mitigation strategies, social distancing, hand washing, and masks are all evolved because of how we know COVID-19 is transmitted. Next slide. Vaccines. Vaccines, December 2020, the first vaccines to fight the infectious disease. But vaccines have been used for generations to fight communicable diseases. The 2 vaccines that we know the most of is Pfizer and Moderna, and these are mRNA. So what these vaccines will do is trigger a response in our body to recognize, to be able to recognize the COVID virus. And so that's why individuals, when they get the vaccine, sometimes can have some very minor symptoms of maybe fatigue, muscle aches, some fever, because your body is creating a reaction to be able to recognize when it's exposed to COVID-19. As I said, Pfizer and Moderna are mRNA, whereas Johnson & Johnson is a vector virus. We don't hear too much about Johnson & Johnson anymore, but it's a vector virus that the virus carried a very, very, very small part of the virus to be able to get an immune response from the body. Next slide, please. The vaccine schedules, I know sometimes they can be very confusing, but just to go over again, Pfizer and the Moderna. If a person in the community 18 years and older, that primary series of 2 doses, that's what we call a primary series, the 2 doses. Pfizer was 3 to 8 weeks apart. Moderna was different. It was at least 4 weeks apart. Then the boosters started coming in. So if it's Pfizer or Moderna, that first booster can be given 5 months after the primary series is completed. And the second booster, 4 months for right now, 50 and over and other chronic conditions or immunosuppressed conditions. Same thing about Moderna. So the other thing to communicate into the community is that an individual who received either Pfizer or Moderna primary series can receive the other vaccine for boosters. So for instance, if I got Pfizer for my primary series, and I could still get Moderna for my boosters and vice versa. Next slide, please. Now, for 12 to 17 years of age, as the vaccine has evolved, we've gotten vaccines approved for younger and younger ages. So it's 12 to 17 now that we're focused on. Again, they do need those primary series. Pfizer recommends 1 booster to this age group after 5 months. Moderna, there's no CDC recommendation for that booster at this time. Okay, next slide. And then we go even younger. We're looking at 5 to 11 years of age. Moderna, there's no recommendation for that, but there is for the Pfizer vaccine. And again, you're going to see that primary series. And in this age group, 1 booster after 5 months. Next slide. And then 6 months to 4 years. I mean, again, it's evolving. It's getting, we're understanding it better. So it's now available for the youngest. Now, this schedule is a bit different for 6 months to 4 years. Primary series is actually 3 doses. Remember, the other age groups were 2 doses. This is 3 doses. First dose, second dose, and then third dose. And this is the weeks apart, the second and the third should be given. At this time, there is no booster recommended for this age group. Next slide, please. Okay, and this is this I think is the important messaging around COVID vaccine, because we've all worked in the community. We've all heard different reasons why people get them, but also why people don't get them. So this is just a way of hearing what some of those myths are, and then some of the facts behind it, and then talking about how we can message our communication to our community. So one is that first, ingredients in COVID-19 vaccines are dangerous. Again, nearly all the ingredients in COVID vaccines are also ingredients in many foods. There's fat, there's sugars, there's salts in that. And again, vaccines have been used for many, many, many years. So there's nothing in there that at this, there's no literature that any of the ingredients are dangerous. Another myth, natural immunity. If I get sick with COVID, it's actually better than immunity I get with the COVID vaccine, which actually has been shown that actually getting the vaccine creates a better, excuse me, immune response in our body, so that we are better able to fight it when we are exposed. Excuse me. So the COVID vaccine is safer and creates more of that robust response. Next slide, please. Now, variants. COVID-19 vaccines actually cause the variants that we've been hearing about, the Omicron, B5, B1s, and all that. Vaccines themselves do not create or cause the variants of the virus. Instead, COVID-19 vaccines can help prevent new variants from emerging by preventing the transmission of it, because the more the vaccine transmits to other hosts, the more likely it can evolve and it can mutate and become the variants that we see happening right now. So in fact, getting more people vaccinated will prevent some of that evolution of the variants from occurring. mRNA vaccine is not considered a vaccine. The fact is that they work differently than other types of vaccines, but they still trigger that immune response. This type of vaccine is new, but research and development on it has been ongoing for years. So the vaccine as an mRNA is new. Research behind it has been going on for some time. However, we do know that it triggers a more robust immune response inside the body. I'm just looking at the chat here. Okay. They don't get the vaccine is because a family member got it, then died. There is surprisingly high number of people saying that. How do I answer that? Yes, well, first of all, very, very sympathetically in terms of their family's loss. I would want to know information. I'm assuming that they died, the cause of death was COVID-19. I would want to, if that's the case, I would not want to know a little bit more about when they did receive the vaccine. Did they get the full series of vaccines as the booster? Did they have any underlying conditions that might have created that body response when it got exposed to COVID-19? So I think it's an opportunity to get a bit more information from them relative to the death of their family member, and better understand when they got, when you say after the vaccine, what does that mean? And I think that's an opportunity for us to talk about some of these myths and facts. I hope that that helps. Okay, next slide, please. So more common myths is the vaccine contains I'm sorry, the vaccine does not contain any microchips. That's one I've heard many, many times in the communities from people in the community. Does not contain any kind of microchips. They're just developed to fight the vaccine. And then many times this leads to a discussion about what microchips are and where microchips where they are available. We talk about the phones, we talk about other things that people use on a daily basis that have microchips. So it's important not just to say, okay, this is what we know, but also this is where we know microchips do exist. The other one is that it makes you magnetic and can cause that. And again, this is an opportunity to talk about, there's no evidence, there's no literature that supports this. And, you know, if people need a demonstration, I've done a demonstration of it. Nothing at all is magnetized to me, and I've had the full series and the full boosters for that as well. So again, it's important to keep those lines of communication open, and not necessarily poo-poo that, because people are hearing it. People do believe it. And this is where YouTube, other social media that people see where it does act that way to other people. This is an opportunity to then continue the conversation, to show people, no, it does not. Okay, next slide. Apologize for coughing on you here. Vaccines, and I'm not positive. I've been testing myself for the last week. It's allergic rhinitis, but the value of having testing available at home. COVID-19 vaccines can alter my DNA. They work by delivering instructions to your cells to start building protection against the virus. So that vaccine, I'm sorry, is giving instructions to start building that protection that we need. After the body produces that response, it discards all the vaccine ingredients. They are just discarded. They are one of the waste products in our body. We get rid of them through our kidneys, urinating, etc. So no, it does not stay in the body. It can make me sick from the virus. They do not contain the live virus that you get if COVID-19 is transmitted to you. So that is not the live virus that's in the vaccine. So thus it cannot make you sick with the virus. It does create an immune response. The immune response can trigger some of those very mild symptoms, such as fever. And that's a very normal sign that your body is building protection, is reacting the way it should. Next slide, please. COVID-19 vaccines will affect my fertility. No evidence that shows this, that it caused any fertility problems. There's no evidence, there's no literature that talks about this. I know people that have gotten the full series and have since gotten pregnant, and you might just communicate that, and that might be your messaging as well. Have you known anybody who has gotten pregnant after they've gotten the full dose? There has been some literature that the COVID-19 can actually contribute to fertility. COVID-19 disease can do that. So again, messaging in the community. Being near someone can disturb or affect my menstrual cycle. Not affected at all. Many things can affect the menstrual cycle. I have here stress, your schedule, problems that you might be facing, changes in diet and exercise. And so if there is a change in the menstrual cycle, it's an opportunity to explore more what might be going on with that person and explore why there might be some changes in their menstrual cycle. Next slide, please. Or was that it? Okay, so that's it for some of the evolution as well as the myth and fact.